I've struggled with this my whole life. Just made me so insecure. It's life-changing. Thank you, Dr. Lebowitz.
This is Dr. Jonathan Lebowitz at the Long Island Gynecomastia Center, Long Island VaserLipo Center. So on this Tuesday morning, kind of mid to late August, just after the solar eclipse, this gentleman, he's in his 30s, he flew in from Florida, and this is a revisional gynecomastia. I did Vaser high definition Power X liposculpture with gland removal in November of last year, and we're going to show you now his pre-op photos. His left side was much bigger than the right side, and he looks amazing. I think if both sides looked like this side, he would say, I'm happy, it's great. He's got a little, still some puffiness over here, which I can kind of hit by the steroid shot because he's got some scar tissue underneath the nipple, because I did do the Vaser with my stealth incision here and a little incision here, which you cannot even see, to remove the gland. But he really, and some people, like I, expect perfection. And so if anybody wants a touch-up, I say absolutely no problem. So now I've got my new tools, my micro liposuctions, mini baby liposuction, and my curved cannulas, and I'm going to go kind of in there and curve them out. I'm going to give them a better deltopectoral groove over here, kind of get this on both sides. Hit this side just over here. I'm going to mark them in a second, and hit this side a little bit better to kind of get this even better. But I think this muscle definitely is bigger than this muscle. It just happens that his pecs are bigger on this side. So again, under local stealth incision, no gland incision because the gland is gone. Hit this scar tissue here, maybe get some steroid in there at a later date, and the results will even be better. So I'm going to give you a little pinchy right here for a second. One ring we're starting with, and then we're going to go to the 5 ring. So 1 ring, this is a redo. I'm not going to do much here, just really underneath the nipple and sculpt this a little bit because he's pretty much absolutely perfect. But this time, because I did them last year, I added since this deltopectoral groove, and that's what we're going to add. So in my little ports, and let's have some fun. It's like Luke Skywalker in Star Wars.
There is no escape. Don't make me destroy you.
So this side's a little bit bigger. It was a lot bigger pre-op, and so we have to hit this side more. So people are not symmetrical. I tell them that they're brothers. Each side is a brother. They're not twins. They're brothers. You know, your brother might be a little bit bigger, fatter, heavier, more hair, less hair. It's the same thing with the side of your chest. All right, 5 ring, 5 ring. The way I'm angling this, I'm getting it right underneath there. With my smart hand, getting right under there to break up and thin down the skin way up here. And then the transition zones up here, I go a little easier. DPG. Everybody asks me, oh, I don't want a scar. I go, you can't even see that scar. Deltopectoral groove. Dr. Jonathan Lebowitz at the Long Island Gynecomastia Center, Long Island VaserLipo Center. Hello. We just did a revisional gynecomastia on him. We did surgery on him almost a year ago, and he had great results, unbelievable results. You saw the pre-op photos. This side was amazing. This side was a little less than amazing. So he called me up a couple of months ago and said, can you touch up? We did a Skype or FaceTime. We said, fine, no problem. So we just did it. But look now, look at his shape. He's got amazing, just nothing here, just nothing here. I can, if he's got a little scar tissue, inject a little steroid in there, which I can probably do tomorrow. I'm not going to do it today because he's all swollen and stuff, just to break up the scar tissue. And by the way, people who have it, that have operated on me, they can contact me anytime and we can do the steroid shot together. I do it overseas, I do it across the USA, and we can do it with him actually too. No new incision here. You can see the old incision is amazing. Little redness from me giving him some local here, but he's going to get phenomenal, fantastic, extraordinary, and permanent results.